Hey guys, so what I'm going to show you now is how you can do a general full knee support taping for around the kneecap there. So think of someone who maybe has a bad knee due to arthritis, maybe have a knee that's unstable when they're at the gym, when they're running or just standing. Maybe they have meniscal problems, joint problems, any muscular problems around the knee there. And so what I'll show you is your go-to universal method. If you don't really know what's going on with the client or with their knee, use it to give more support to the person, help create a more stable, better healing response by just decreasing the pain in general in that area. Remember, a lot of these taping techniques I'm showing you is things you could actually do at home, like for your kid that plays any sports, if you have like a guardian, parent, anything like that, what you can do to fix those problems, or at least help that person give a little more support, create a little more support, a healing response in that area. And well, today we'll be doing the knee, how we can depress the pain with kinotape. So what we'll do is we'll start with 3 strips. Remember these, if you get these KT tapes, just know that these strips, they're cut at 10 inches, 2 by 10. So if we're dealing with a child, teenager, anyone in that age range, you'll definitely have to maybe cut about 2 inches or more than that, just so they could wrap around properly around the muscle in the kneecap there. So just keep note of that. But other than that, we'll need 3 strips today. So I'll be using two strips, 2 that will go around the kneecap. Well, they'll start on the quadricep, go around the patella there, and then they'll eventually get in the tibialis anterior of the leg there. And then one of them would just be for support. This is the one that we probably would want to cut just a little more, about 1/2 or 6 inches, and that will go right underneath the knee there. So let's get to it.
Alright, so that first thing we're going to put on is that decompression piece. As you can see, I already pre-cut it, rounded the edges, just so it's a good fit right underneath the kneecap. And you'll definitely have to do this if you're dealing with a teenager, child, or well, anyone in general with a smaller leg. You'll definitely have to cut that piece. We're going to put that right there in the inferior aspect of the patella, right underneath the kneecap there. So this part of the piece is more of the decompression portion of it. And so we're going to stretch out the tape to about 80 to 90% stretch. So the way to determine that is you stretch out the tape at full. Here's 100. Better visual here, 100. Now back it off a little slightly, and there you go, 80 to 90. Go ahead and place it there, right underneath the patella there. And this is great pain relief, especially for any anterior knee pain you may have, or patellar tendonitis, that sort of thing. Just great. So no stretch, of course, right there on the anchors. And there you are. There's your decompression portion of it. Just make sure you give a little friction on the ends of the anchor there, just so that it sticks properly. Another thing too, I mean, you see I didn't really shave for the video, but definitely recommended where we stick on the tape, have that area trimmed, shaved off, just so it sticks properly. And trust me, you don't want to be pulling this type of tape off with any hairy limbs, whether it be the legs or the arms. This hurts a little more than your average bandage or tape. So we'll use the longer piece of tape, and then we're gonna tape it up on the lateral aspect of the quadricep there, or you can start the medial one, whatever you choose. So you'll rip off the paper there, get your anchor ready, and you could always line it up too beforehand. you just want to make sure that you know you got the right length. That way you don't go straight to sticking it on the leg and then realizing it's a bit too short or a bit too long. So you'll place the anchor, zero stretch, start lining it up. As I'm putting on the tape, I'm giving just the Kino tape about maybe just 20% stretch. It's just very slight, just off slack, and that way you could guide it gently around that lateral aspect of the patella there. And then you could see I crossed over the tibial tuberosity, and in the end, just drop down your anchor with zero stretch. And there you are. And like I said, this is a real good taping technique for people with knee pain and any knee injuries in the past, anything. And then the other one, we're just gonna line it up as well. We'll go start in the same distance, drop the anchor there, just along this, just about the same range as on the other side, on your quadricep there. And again, you could always measure it out before you pull off the tape, just to make sure you got your distances correct, you know, beforehand. And the knee's always bent, as you can see here. And once again, hardly ever any stretch. I give it like 10 to 20. And they're guided around the medial aspect of the patella there. Bring it around the inferior aspect, cross over the tape, around the tibial tuberosity, give it a little rub, and then down goes your anchor. And there you have it. That's how you do the full knee support with kinotape. Such a cool little technique you could do, you know, with your clients, with anyone at home that has any previous knee injuries, or an athlete living at home, or shoot for yourself. One of the things I did forget to mention is if you have one massage gun here, instead of having to rub the anchor portion of the tape, one thing I like to do with my clients is use the massage gun as your kinetic energy to make sure that tape doesn't go anywhere. So I like to start off at the anchors, use it there for a few seconds, and then just go down the tape there. And you know, it's just a little extra touch that I like to do. That comes in handy, having the tape stick there just a bit longer. So try it out, see for yourself. Let me know what you think.